I'm very pleased tonight to have as my guest Mr. Robert Pryor, one of our area's excellent speech pathologists. Mr. Pryor has been in practice in this exciting area for over 15 years. Welcome to the Medical Explorer, and thank you for coming over tonight.
Thank you for asking me.
Oh, my pleasure. Let's begin by having you tell us exactly what's meant by the field of speech pathology.
Speech pathology is essentially the study of the language and the study of the production of the language. We deal with problems of the language, problems in interpreting or expressing self, and problems in the production of speech.
Quite a large area there you're covering. Tell us about the educational background and training that you have, and how does that meet the state requirements?
My training was at the California State University, Chico, and also at the University of Pacific. The speech pathologist is required by the state of California, the Audiology and Speech Pathology Examining Committee, which is a part of Board of Medical Quality Assurance, to pass board tests and also to have a certain number of units in practicum, etc., involved in speech pathology.
Is a speech pathologist the same as a speech therapist?
A little bit different. A speech therapist we usually refer to as a school personnel. They even have changed the name of the speech therapist to speech and hearing specialist in the schools, where a speech pathologist is one who is licensed.
I see, because I remember back in school days, the speech therapist being in school, doing their thing.
Anyone in private practice, working in hospitals, working in clinics, is required to be licensed by the state as a speech pathologist.
I see. What are some of the disorders that affect speech and language that you deal with?
We tend to divide the practice into speech disorders, which are essentially orders of articulation or making sounds, disorders of voice, and stuttering disorders. And then we divide the other segment into language, either receiving or expressing language, not only as far as in words, but also in writing and reading and understanding.
How would someone know if they really needed a speech pathologist?
If their speech calls attention to itself, if they're having difficulty understanding, if they're having difficulty communicating, either the child or the adult, they would probably be one of the first aware of their dysfunction.
Do schools ever refer children to you?
At times they do, depending upon the severity of the case.
But they have people also dealing with that in the public school system.
The Marysville-Yuba City area, combined with Sutter County schools and Yuba County schools, has approximately 28 school speech therapists.
How would we find a qualified speech pathologist like yourself if we needed help?
Often your family physician or a specialist will refer to a qualified speech pathologist. The California Speech and Hearing Association or the Board of Medical Quality Assurance would also be aware of those who are qualified.
I notice you keep very good contact with the physicians in the area. That's commendable.
Well, thank you.
Communication open. Very nice. How can we tell when we go to an office, someone calling themselves a speech pathologist, if they're qualified?
We would ask to see the license. We could check with the Board of Medical Quality Assurance as well.
You can make the phone call and actually get that information? Great. How many speech pathologists are there in practice in our area here?
There are 3 of us in my office who are in practice. Mine is the only full-time practice. There are 2 other people who do part-time speech pathology. But I have myself and 2 other clinicians in my office.
We often hear about a word called aphasia when we talk about disorders of speech. What is that exactly is meant by the word aphasia?
Aphasia is caused usually by some kind of insult to the brain.
Damage of some type.
Yes. Where the individual no longer can communicate in the modalities which he or she used to, caused by stroke, caused by bullet, caused by automobile accidents.
How do you actually treat that condition? That was just a pretty broad question, but what are some ideas that you can use to treat people?
Well, there are a variety of methods, but what we're essentially trying to do is retrain the individual to help his or her understanding of language, to help his or her expression of language. At times, however, we find patients whom we cannot treat, whose injury is so severe and whose recovery is so limited that we have to find alternative modalities, alternative methods for them to communicate. As a result, we sometimes go to synthesized speech.
I'm glad you brought that up because I love gadgets, and you've got some great ones here.
Well,
let's just show us some of these little things.
This particular instrument is put out by Texas Instrument, and one might refer to it probably as the least of the synthesized speech devices. This particular instrument we might call a communications device or a communications prosthesis. And the reason we're using the word prosthesis is very much like we would use the word prosthesis for an artificial arm or an artificial leg. This instrument is artificial for communication. The Vocaid put out by Texas Instrument has 36 squares with an interchangeable overlay, and this particular little device is set up for communication over the telephone.
Hello. I am using an artificial voice with a limited vocabulary. Please ask so I can answer.
That's fantastic. I got to try this. You've got to show me how to push these buttons now.
Any button that you would
Do we
like.
push on first?
It is on already, so
okay, it says
it'll
here,
stay on.
Help medical. So I'm assuming someone could be on a telephone and ask for medical assistance.
This particular unit hooks right into the telephone.
Help. Medical emergency.
That's fantastic. And there's another one that says police.
Help. Police. Emergency.
That's great.
My number is 674.
Etc.
That's great, so that you could really get help if you really need it. Now, you have another one back here that's a fancier machine even than this. This can be programmed and give sentences.
Yes, this particular device is what we would consider the Cadillac of communications prosthesis, and of course it's...
Nowadays we'd have to say Mercedes.
Mercedes, yes. Its price tag is also quite high, but when you're thinking of someone with cerebral palsy or someone with no possibility of communicating via speech, its price is somewhat small. This particular unit is about $3,500, where the first unit I showed was about $150.
Hello, Dr. Peppercorn. How are you?
Oh, thank you. That's very nice. I like that, I'll have to say. Maybe we can get one of these to help run our show. What do you think about that?
This has approximately 999 pre-programmed words, approximately 50 programmed sentences, as well as you can say anything on this device that you can in your own language.
We hear about the word laryngectomy when, I guess that means when someone has their larynx removed, is
That's
that true?
correct.
I guess cancer and other things can be reasons people have the dramatic surgery. What do you do after a laryngectomy to help people speak?
We use a method called esophageal speech as,
so you don't have to resort to these
chosen,
machines.
so we don't have to resort to these. Maybe in the interim we would like our patient to use one of these. However, we would prefer, because these in themselves are somewhat handicapping, and that you have to punch up the particular phrase and or sentence. Therefore, we want our patients to, if possible, use esophageal speech, or another word for that is the belch method, where air is projected down into the esophagus and the individual belches that air back up in a stream of fluent speech.
So we're actually using gases, oxygen and air in the stomach, and using the stomach muscles, forcing air up and actually using that to speak. That's amazing. I've seen it. It's hard for me to imagine people doing it, but people do learn.
Oh, yes.
And you teach them how to do that.
That's correct.
What are these mechanical devices I've seen these people holding over their neck? It's sort of an electronic little device.
They're vibratory mechanisms of one sort or another. I have a tendency to hope that my patients don't have to resort to those vibrators because they add to an already noticeable handicap by essentially, when the vibrator is put to the throat, losing the use of a hand while they're talking. Consequently, we would prefer esophageal speech.
I see. So you're not using esophageal speech when you're using that vibrating device. I see. Let's change subjects a little bit. I remember when I was growing up that there always seemed to be at least one child in the school I was attending that had trouble with stuttering. These were children that just couldn't get the words out of their mouth. What exactly is stuttering? What's going on in those people?
Well, stuttering is a disorder of rhythm, and we refer to it as a speech disorder. Of all the speech abnormalities, stuttering probably has the most written as well as the most divergence in opinions. There, for every individual who is involved in speech pathology is his or her own theory. Research is indicating that stuttering is primarily, however, a learned behavior, in that the individual, for one reason or another, learns to speak disfluently.
You mean when he's an infant learning how to speak?
Yes, There is, of course, a psychological overlay involved in stuttering, but it's one of the chicken and the egg kinds of concepts. Did the stuttering cause the psychological dysfunction, or did the psychological dysfunction cause the stuttering?
How do you treat it? What can you do?
We use a number of methods. One is a behavioral method in where we actually teach the individual to talk with prolonged, elongated sentence and word structures, and in that manner teach them a new rhythm pattern. We do not, however, ignore the feeling aspect, because we indeed do talk about the psychological aspect of stuttering as well.
Can you help someone by just telling them to stop stuttering? Does that do any good?
Absolutely not.
That just makes
Calling
it worse.
attention to it will cause more stuttering.
Is anyone ever really cured of it?
Difficult question, and a good one. The stutterer quite often, even if he is completely fluent, without any blocks at all, still considers him or herself a stutterer and is a member of that distinct club. However, fluency can be controlled to the point that most people would not notice that there was any disfluency.
Well, unfortunately, our time is running out. I'd like to thank you for taking the time out of your busy schedule so you could join us tonight on the Medical Explorer. Thanks again for being here and for that excellent demonstration.
Oh, it's been my pleasure.
Thanks. I'd like to invite you to write to me at the Marysville Medical Clinic with your suggestions for areas and people that you'd like to see on this program. The Medical Explorer is a public service program, and I really do want to hear from you with your comments and suggestions. Please write to me at 800 3rd Street, Marysville 95901. Till next time, I'm Dr. Robert Peppercorn, your Medical Explorer. Thank you for joining us tonight, and have a good evening.